Hello, everybody. 7 o'clock sharp. We're starting on time. I am excited. This is the first webinar that I've ever done exclusively for my readers, and the response has been overwhelming. We've had 1,600 people register for this thing. The room has capacity for about 1,000. We've got a little coffee wager on what the number is going to be. I've got the over number because I'm optimistic. So we need 801 people to watch this thing live. But thank you all very much for supporting my work. And it's a real pleasure to get a chance to talk to you. I wish we could be interactive, but with this many people, obviously we got to shut you all down. And it's just going to be my friend Ari and myself talking to you. We've got his sidekick Kevin in the background monitoring the Q&A. So feel free to type in your comments, but don't expect us to answer while we're trying to talk here. So that's how we'll manage things. We've got some questions. Thank you all for submitting your questions. A lot of questions on the blog post that I wrote and on the email that I sent out. So we'll address those in the end. And we'll also have Kevin sorting through your questions as we go. And if anything comes up that we aren't addressing in the Q&A, if we've got enough time, we'll address those as well. So with that, let me say, this was not my idea to do this webinar, my first one, but it was actually Ari's idea. Ari Parker is the guy in the middle. You're going to be meeting him soon, and he is a true expert. I wrote about him in my blog post. It's up on the screen right now for those of you that happen to read that. And I started looking into Medicare. I'm 62, and I just didn't want to get into the hassle of trying to figure this all out. And I said, what if I just spend my time researching companies that do this for a living? And I came across Ari and his company, which is absolutely world-class chapter. You guys will meet him here shortly. And I wrote in this post that we formed a partnership. And as we were working through this partnership, Ari said, well, how about if I do a webinar and just kind of cover the basics? I said, perfect idea. Let's see how it goes over. And the response has absolutely blown me away. In addition, in this article, I had a link where you can get in touch with these guys directly. And we've had over 150 people that have already clicked that link, which is phenomenal. So I was pleased. The other thing that Ari is doing in his company is they're offering everybody on this call a free copy of his book, which I happen to have here. It's not that complicated. It's a really good summary. It's not a big book, but it's the keys. It's a lot of what he's covering today. And it's basically the keys of the overview of Medicare and how it works. So get your free copy, scan that QR code, write down the note, askchapter.org/retirement. You can get it after the show. If you're watching this recorded, you can get it at the same time. And give it a read. It's a good overview, and it'll go into a little bit more depth than Ari's going to go into today. So that's great. Let me tell you something. I've never recommended a company that I've not worked directly with, and I have not yet signed up for Medicare. So I was a little bit nervous, right? But I did my research on these guys. The main reason I chose them is three big things. Number one, they work with Dave Ramsey. He has his whole staff. They vetted them thoroughly. I'm like, okay, Dave Ramsey's top notch. That earned some respect for me. They've got 2,500 reviews, and they've got a 5.0 rating. No company has 2,500 ratings with a 5.0 rating. Really impressive. And the third thing, and this was the biggest for me, I've always been concerned if I hire an advisor on Medicare, how do I know what their motives are, right? There's different commission structures on different products. I don't know if Ari will get into this or not, but from my research, I know the Advantage plans tend to have a much higher commission for the salespeople. I didn't want to have a salesperson recommending Advantage to me and having it driven because they're getting a better commission rather than it being the best product for me. What I love about what Ari's done is his advisors are blind to the commissions, which I really respect. They're just offering products based on a system that maybe we'll touch on. It's to me, it was refreshing and gave me an element of trust. The last thing I'll say, there's a friend of mine that's on the thing now. His name's Rodney. I'm in a Bible study group with him. We had a Bible study last night, and he said, Fritz, he said, I got to tell you, he said, I contacted Chapter, and he said, man, those guys are good. He said, I filled out a couple quick things online. I had a quick phone call. They were bam, bam, bam. Here's the best plan in your area. Here's the price. Here's your options. Are you ready to sign up? We can sign you up right now. And so that made me feel so much better because obviously I haven't signed up for Medicare yet. So I did this one a little bit different, but that really gave me some assurance. And I think you guys will be pleased with them. The last thing I'll say, that's the end of the sales pitch. I've asked Ari, don't make this a sales pitch, even though I just made it a sales pitch. Don't make this a sales pitch. Make this about Medicare. So let me introduce Ari to you. He's first class. He's a graduate from Stanford. Oh, let's throw their disclaimer up there. You guys can read this. They got to do that by law. You can read it if you want to. Ari is a graduate of Stanford Law, so he's a smart guy. More importantly, he co-founded Chapter, and he is a true Medicare expert. You guys will hear him here in the next 30 seconds. He's been featured in the New York Times, Wall Street Journal. He's been on TV numerous times. As you will find out very, very shortly, he is very well spoken. He's very educated. And the other thing I will say is I've dealt with maybe a half a dozen people in his company. And I told my friend today, I was on a hike with him, and I said, every one of the people that I've talked with in this company, back when I was working in, I was in managerial positions, I would have hired every single one of them. They're all first-class people. And the agent that my friend talked to, he said the same thing about him. So first-class organization, first-class people. With that, I'll turn it over to Ari. Thank you, Ari, for suggesting this. Thank you to my readers for attending. I hope you get some benefit out of it.
Thank you so much for having me, Fritz. And thank you to your community for joining the presentation today. I'm delighted to present. Chapter is the only independent, unbiased Medicare advisory. I'm going to go through what that means over the course of the presentation. But first, let me give you a little background about Medicare, so just enough that you can be dangerous. Picture Medicare as a three-legged stool, 3 parts to Medicare. The first leg of the stool is your hospital coverage. That means you're inpatient. You have a wristband. The second leg is everything outside the hospital. That's your outpatient coverage. And then the third and final leg of the stool is your drug coverage, how you get your prescriptions covered. So 3 parts to Medicare. Let me unpack these components a little further. Medicare Part A is your hospital benefit. This covers you when you're inpatient. It also covers you when you're receiving inpatient mental health care, skilled nursing facility care, home health care, though this is very limited, and hospice care. Then there's Medicare Part B, the second leg of the stool. This is your outpatient coverage. This is visits to your doctor, visits to specialists, lab work, x-rays, MRIs, CTs. I could keep going. It even covers durable medical equipment and vaccines. Now you're probably wondering, how is this paid for? Medicare Part A is paid through your federal payroll taxes. So if you or your spouse has contributed federal payroll taxes for at least 10 years, then Medicare Part A is premium free to you. So there's no monthly charge for your hospital coverage, but there is a deductible, and it's quite substantial. It's approximately $1,700 for this year per hospitalization. Then there's Part B. There's a monthly charge for Medicare Part B. The charge for 2025 is $185 per month for most Americans, and there's no family plan. So if you and your spouse are on Medicare, then you each owe $185 per month. And if you're a high earner, then you're going to owe more. And we'll talk about that a little later on. Together, the first 2 legs of the stool are referred to as original Medicare because they come straight from the government. They're printed on your red, white, and blue card. So here we have John Smith's red, white, and blue Medicare card. You can see that John has a unique Medicare identifier. It's no longer your Social Security number. Instead, it's an 11-string character, and that is the card that you provide to the doctor. And if you have some type of additional coverage, then you give that card to the doctor as well. And on John's card, you can see that his Part A and his Part B date coincide because John turned 65 in March of 2016. For someone who's beyond age 65 and waits to start Medicare Part B, your Part B will just be after your Part A date. That's quite common. So if you're applying for Medicare by way of turning 65, then your Part A and your Part B date will match. If you delay starting Medicare by way of remaining on yours or your spouse's work-provided coverage, then your Part B date will be later than your Part A date, and that's totally normal. And we'll talk about those 2 ways to apply for Medicare as we go through the presentation. I want to say a little bit about the third leg of the stool, Medicare Part D. This is your coverage for prescriptions, D as in drugs. And there's 2 reasons to get it. The first is so that you have prescription insurance during the course of the year. There are some big changes that went into effect as of January. I'll cover those over the course of the presentation. The second reason I would encourage someone to think about getting a prescription drug plan if they're eligible for Medicare is to avoid lifetime penalties. So many people are surprised to learn that there's actually a lifetime late enrollment penalty if you defer signing up for Part D and don't have coverage at least as good as what you would have received through the Part D prescription benefit. So there's two ways to get it. Don't worry, you don't have to remember it now. We'll cover it over the course of the presentation, but there are two ways to make sure that you get your Part D. What I want you to know is that original Medicare, Part A and Part B, does not cover your drugs. You have to get your drugs separately through a private insurance company. And that's exactly one of the things that the chapter team is here to help you with. Now, with that, I want to turn to the 7 crucial mistakes that we help our clients avoid, and you're going to avoid them by virtue of having attended this presentation. The first mistake we see people make is that Medicare begins automatically. They assume that Medicare begins automatically when they turn 65. This is only true if you're taking Social Security. So if you started Social Security before age 65, then the government will send you your red, white, and blue card 3 to 4 months before your 65th birthday. Well, what if you're not taking Social Security? Most of you aren't. Well, then you're going to use your initial enrollment period in order to sign up for Medicare. Your initial enrollment period begins 3 months before your 65th birthday, and it extends to your birth month and 3 months after your 65th birthday. So there are 7 months cumulatively in your initial enrollment period. Let's go through an example. Let's say Kevin is turning 65 on December 23rd. The earliest Kevin can sign up for Medicare is September 1st. And as long as Kevin signs up in September, October, or November, then Kevin's Medicare will be dated to December 1st. It always goes to the first of the month. But let's say Kevin is busy with his grandchildren and he delays signing up for Medicare until December 2nd. Kevin's Medicare won't begin until the following month. So Kevin won't have coverage for the month of December. Big impact. He'll be uncovered for a month if he delays signing up. And let's say Kevin procrastinates even further. Then his Medicare will just continue to get delayed. And if Kevin misses his 7-month initial enrollment period, then he's in a world of hurt. So if you know that you need to start Medicare by way of turning 65, the best time to do so is during your initial enrollment period, and that opens 3 months before the month in which you turn 65. Now, you might be wondering, do I have to call the Social Security Administration in order to sign up? The answer is no. It takes less than 5 minutes to apply to enroll in Medicare if you do it through your online Social Security account portal. It's safe, easy to use, and secure. So you definitely want to make sure that you have access to your online Social Security account portal because that's how you're going to apply to enroll in Medicare. And it's also important to have access anyways, so you can check your earnings history to make sure that the government has recorded it accurately for the purpose of collecting your Social Security. So I highly recommend making sure that you have access to your online Social Security account. Now, let's change this hypothetical a little bit. Let's say Kevin is still working. If Kevin is still working and he wants to continue on his work-provided insurance, then he can do so as long as his employer has 20 or more employees. Instead, when Kevin is ready to retire, he will use a special enrollment period in order to apply for Medicare Part B. So 2 or 3 months before Kevin is ready to retire, that is when he would go to his online Social Security account portal and begin the process of applying to enroll in Medicare Part B. This also applies if Kevin is covered under his spouse's insurance. However, his spouse's employer must also have at least 20 employees. So, who are the people who need to apply for Medicare by way of turning 65? Someone who works for an employer or their spouse's employer, and they have 19 or fewer employees. 19 or fewer employees. Someone who is on Obamacare also needs to apply for Medicare by way of turning 65 because you're going to lose your Obama subsidies if you're eligible for premium-free Part A. Additionally, this last one might really surprise you. Someone who's on COBRA needs to apply to enroll in Medicare by way of turning 65. The reason is because COBRA isn't considered active work-provided coverage, and it is only secondary to Medicare. Medicare is supposed to be your primary. So over the summer, we were helping someone who had thought that COBRA was creditable for the purpose of delaying Medicare, and they actually needed a $70,000 infusion. Their COBRA insurer refused to pay because their COBRA was only secondary to Medicare and they hadn't started their Medicare yet, so they didn't have primary insurance. It was a disaster to fix. So be sure that you know when you need to apply for Medicare, and I'm sure we're going to get some questions in the Q&A, and I'm looking forward to answering them as we go along. But know that the best time to apply for Medicare is either by way of turning 65 or a month or two before you or your spouse is ready to retire if you're beyond age 65. With that, let me turn to the second mistake that we see. The second mistake is people assume that it doesn't matter when they sign up for Medicare. Well, you already know that this isn't true. It really matters so that you can have health insurance, because Medicare is designed to be your primary health insurance unless you're on yours or your spouse's work-provided insurance, and that employer has at least 20 employees. But what are the penalties if you miss your enrollment period? Well, the penalties are actually pretty substantial, and they continue to compound, and they're lifetime. So for someone who delays signing up for Medicare, they will not only owe a Medicare Part B penalty if they wait at least 12 months in order to sign up. That penalty will grow 10% for every 12 months in which they continue to wait. So someone who waited 5 years too long in order to sign up will owe a 50% penalty for their Medicare Part B. And what's more is if they don't have the option of drug coverage at least as good as what they would have received from the Medicare Part D program, then they will also owe a late enrollment penalty for the drug plan. So we definitely want you to avoid these late enrollment penalties. Fritz, I know you're 62. You're taking notes on this presentation. Your friend Raymond is doing what he needs to do because he went on a hike with you earlier today. If you have any questions as to what enrollment period you're going to use to start Medicare, that is something that we're here to help you with. We take an education-first approach, and we want to give you the information that you need in order to protect your health and wealth and make sure that you're not subject to these late enrollment penalties.
Let me jump in, Ari. I want to reiterate, these are lifetime penalties. It's not just the first year. And there were some comments in my blog post about this. Somebody said, hey, make sure you sign up in time because I got hit with a 20% penalty and I'm paying it for life. So these are lifetime penalties. If you live to 85, you're going to be paying a 20% penalty for the next 20 years. So it's a big penalty.
It is. And as you mentioned, it's lifetime. And once you start, they're going to invoice it to you if you're not already taking Social Security. And if you are taking Social Security, it's deducted straight from your Social Security check. So it's something to certainly be cognizant of. And it's something we help people avoid every single day just by giving them the information that they need to know. If you're waiting to receive that Medicare and You handbook in the mail, which every Medicare beneficiary receives in the fall, that handbook is over 130 pages long at last check, and you're going to have to skim through it in order to find the information that you need. So I hope that by presenting the information in a more digestible manner, you're able to know what is applicable to your circumstances. And if you have any questions, we're available if you pick up the phone. We're right there to help you. With that, let's turn to our third Medicare mistake, which is, for those of you who are high earners, there are actually two high earner taxes. And you might think, oh, well, there's nothing I can do about the Medicare high earner tax. Not so. Your high earner tax is predicated on a 2-year look back. So who does this high earner tax apply to? It applies looking at your 2023 tax return. So it's a 2-year look back. Looking at your 2023 tax return, if you earned more than $106,000 modified adjusted gross income and are a solo filer, or $212,000 as a joint filer. So if you earn more than those threshold amounts, then IRMA applies to you. IRMA is the government's acronym for the Medicare high earner tax. It stands for the Income Related Monthly Adjustment Amount. It's quite a mouthful. Don't ask me how the government creates these acronyms, but that's their acronym for the Medicare high earner tax. Now, this is something that we can actually help you appeal. And you don't want to use this askchapter.org/Fritz. You want to use askchapter.org/retirement in order to access it. But if you use Fritz, I hope it still works and goes to the right place. That is where we can help you appeal your Medicare high earner tax. And we'll talk a lot about who can appeal the tax, but you should know first whether it applies to you, and it applies to someone who are in more than 106K and files solo, or 212K and files jointly. And what we do when we help you appeal, and this is a form that we use from the government, it's Form 44 if you want to check it out on your own. What we do is first, we make sure that you have a life-changing event. A life-changing event, the two most common are work stoppage or work reduction. Sadly, the third most common is divorce. But having a really good year in the stock market or selling an investment property, that doesn't count as a life-changing event. So you should know that first you need a life-changing event, and then you ask the government to look at a more recent year. Because many of you have already done your tax return for 2024, or you're in the process of working on it right now. So instead, you just ask the government to use a more recent year based on your life-changing event. You can even ask the government to look at your anticipated income from this year, 2025. So I hope that helps our high earners in the audience. We're going to come back to this in the Q&A. All right, let's get to the meat and potatoes of the presentation now that you know enough to be dangerous on the basics of Medicare. The biggest misconception we see people make is this fourth one. They assume that original Medicare covers all of their costs. They assume that original Medicare is comprehensive. It isn't. There's a 20% gap. So remember that Part B premium of $185 per month? What you get in return is 80-20 coverage. The government picks up 80%, you owe 20% out of pocket. And there's no out-of-pocket maximum on that 20%. So this is why some seniors have to declare medical bankruptcy, because 20% of a very large hospital bill is still thousands of dollars. And the same thing goes for a specialist visit or an infusion. This is why it's so important to understand the two types of additional coverage. And the good news is that there's only two. So with that background, now you know that the key question is how will you cover the 20% that original Medicare doesn't cover? Remember, Medicare pays at most 80% for your medical expenses, and that leaves you holding the other 20%, paying the other 20% out of pocket. What's more is you know at this point that original Medicare doesn't cover prescriptions. And further, I'm sorry, but Medicare doesn't cover dental, vision, or hearing. So when Fritz's audience realizes that Medicare has these deficiencies, they look for some type of help. And I have good news. There are only two ways to achieve comprehensive coverage. Option one is to keep original Medicare and add a Medicare supplement plan, which is also known as Medigap. This sits on top of your original Medicare, and it covers the 20%. It's the most flexible, comprehensive coverage, but it doesn't cover your drugs. So if you go with option one, you still need a standalone prescription drug plan. And for those in the audience who travel, Fritz, I know you have a home in Georgia and you also have a home in Alabama. That you probably want to consider option one carefully because you may want to get medical care in both places. So for those of you who travel, think carefully about option one because you're time restricted as to when you can obtain it without questions about your medical history. In 46 states, you only have a one-time Medigap open enrollment right to sign up for option one without any questions about your health history. Once you're outside that 6-month window, a carrier can ask questions about your health. And if you have a chronic condition or pre-existing, you can be declined. And they even consider diabetes a pre-existing condition. So be cognizant of that. If you know you want option one, then the best time to sign up for it is when you start Medicare Part B, because then an insurance company can't discriminate against you. They can't decline you. They can't charge you a higher price. Then there's option two. Option two is what you see advertised on television. You probably have seen the Joan Namath ads on option two. This is Medicare Advantage. Medicare Advantage is a replacement for original Medicare administered by a private insurance company. So it's subject to the insurance company's terms and conditions. This is where we get into the world of HMOs and PPOs. So it will feel familiar to those of you who are coming off work-provided coverage. What I should mention here, though, is that it is lower cost than option one. So if you're in good health and you don't go to the doctor that often, a Medicare Advantage plan might work really well for you based on your circumstances. But there's hundreds of health insurance companies offering thousands of plans. So we need to make sure that the plan that you choose covers your doctors, that it covers your prescriptions, and that it meets your healthcare needs, because you don't want any surprises. And the same goes for option one as well. But I'm going to talk a little bit more about option one in just a moment. Actually, I'm going to talk more about both of these options, but I just want to pause there. Fritz, do we have any questions on the difference between Medigap and Medicare Advantage?
No, I think the things I've always read about, being relatively new to it, and I've had a friend of mine who's a bit of an insurance expert. He said, the concern he's always had with Advantage is their denial of service rates, or whatever you call it, when they have to pre-approve a lot of procedures, whereas in option one, that pre-approval isn't required. So you can address that. And then the second thing is, if you start on Medicare Advantage, as you said, it can be very difficult to move back. And if you start getting into a different health requirement and your Advantage plan suddenly isn't working and you want to go back to a traditional Medigap, it can be more difficult to do it after the fact. I think you'll address that in some of the questions. So those are the 2 points that come to my mind. The last one, just to reiterate what you said, if you spend time in multiple states, my understanding too is the Advantage plan tends to be regional. So I could only, let's say, get coverage in Georgia, and when we're in Alabama, I could potentially be uncovered if I had the Advantage. Whereas with the original Medigap, it's nationwide, doesn't matter.
That's right. In the event of an emergency, you'd still be able to access life-saving care, even if the institution you went to is out of network. But that's right. If you wanted to see a specialist and they were out of network in Alabama, let's say, because your primary residence is in a different state, then you'd be out of luck and you'd owe 100% at the time of service.
Yeah.
All right, let's unpack option one a little further. Option one is Medicare Supplement, which is also known as Medigap. And so we throw these terms around. I want to cut through the jargon. Medicare Supplement is also known as Medigap. They are synonymous, but I like calling it Medigap because it allows your mind's eye to picture exactly what it does. It covers the 20% gap that you would otherwise owe out of pocket. Here's why people tend to like Medigap. The first is they appreciate its networkless freedom. You don't have to worry about whether your doctor is in or out of network. The only question is whether they accept original Medicare. And according to Kaiser, over 93% of doctors accept original Medicare nationwide. Really, the primary exceptions are some doctors in Manhattan, South Florida, and Los Angeles. So if you don't live in one of those areas, then really you can have a lot of confidence that your doctor accepts original Medicare. And that brings me to the second thing that people really appreciate about Medigap, which is they appreciate the freedom of not having, of being able to access coverage nationwide. If you want to go to the Mayo Clinic to get a second opinion, or MD Anderson, which is probably the nation's leading cancer research institute, you don't have to worry about it. You can go to those institutions. They accept original Medicare. But do you know who those institutions don't work with? Medicare Advantage. So if you know that it is important to go to certain institutions, then you want to think carefully about Medigap. The other two things that I want to mention on this slide is with a Medigap plan, if you're on the most comprehensive Medigap plan letter type, which I'll cover in just a minute, then your deductible for the year is $257 because that's the Part B deductible for this year. So the Part B premium is $185 and the Part B deductible is $257. On the most comprehensive Medigap plan letter type, that is also your maximum out of pocket. So your maximum out of pocket for the year would be $257. And then the final thing is Medigap is designed to last a lifetime. It is standardized under federal law. So Medigap plan letter F is standardized under federal law. Medigap plan letter G is standardized under federal law. That means regardless of the insurance company that you choose, the carrier must cover the same hospital and medical benefits for any given letter type. And this is really important because do you know what is not standardized across those insurance companies? the price that you pay. So it's so important that you optimize this decision because you're making a 30 to 35 year purchasing decision. It's a much longer purchasing horizon than what car to buy. You are probably going to remain on the plan, the Medigap plan that you sign up for the rest of your life. So the way that I train our team here is marry your Medigap, date your drug plan. You want to optimize the Medigap plan that you sign up for right when you turn 65 because you're probably going to keep it for life. Every fall, you want to review your drug coverage though. And that is part of our ongoing relationship when you work with the chapter team. Every fall, we're going to make sure that you're happy with your Medigap plan and that we review your drug coverage if you choose option one. On average, just by taking a few minutes in the fall to review your drug coverage, let's say 20 to 30 minutes, we help our members save $1,100 on average. That's how significant the savings are just by reviewing your drug coverage each fall. Now, I mentioned Medigap plan letter types. Let me go over the most comprehensive Medigap plan letter type for someone who recently turned 65. It is Medigap plan letter G. G is in George. Here's what a Medigap plan letter G covers. The first is you won't have any network restrictions. It is networkless. Your network is the same as original Medicare, and almost every doctor and institution except original Medicare nationwide. Under Medigap plan letter G, you don't need to ask anyone's permission in order to get a second opinion or to see a specialist. In addition, there's no bills or copays once you meet your $257 deductible. So that Part B deductible for 2025 of $257 is also your maximum out-of-pocket under Medigap Plan G. It works nationwide, so if you have grandchildren that live in Arizona, but your primary residence is in Florida, then Medigap Plan G is something to strongly consider. If you have an RV, you love to travel. And finally, if you plan to travel abroad, you ought to consider Medigap Plan Letter G because it includes 80% international coverage. Fritz mentioned that we were mentioned in the Wall Street Journal, specifically a reference that one of the stories that the Wall Street Journal picked up on is that we had a client who was vacationing in France and they were hospitalized because of a heart condition that they suffered. And they spent a couple weeks in the hospital and they racked up $30,000 in hospital bills while they were abroad. Because they were on Medigap Plan Letter G, our member support team was able to help them get $24,000 in reimbursement. So it didn't ruin their trip. They were delighted when they realized that they were going to be able to get some help with their tens of thousands of dollars in hospital bills, even though they were abroad. Now, I should note here that that foreign travel emergency benefit is subject to a $50,000 lifetime limit, but that goes a long way in other countries who have less expensive healthcare systems than we do. Let me say a little bit more about Medicare Advantage. Remember, Medicare Advantage is option 2, and you can't choose one or the other. It's either you go option 1 or option 2. You can't have both. So option 2 is Medicare Advantage. Remember, this is a replacement for your original Medicare administered through a private insurance company. It is managed care. And as Fritz mentioned, thank you so much for bringing this up, Fritz, it is subject to prior authorization. And so people who are on Medicare Advantage plans had over 50 million prior authorization claims that were submitted last year. So this can really be a hassle when you need to get certain types of care. Your insurance company can make you explain why you need the care. They can make your doctor explain if you're on an Advantage plan. So it's certainly a trade-off to consider. And if you have a lot of health needs, then that might be decisive in which option you choose to go with. Now, let me say here, what people really like about Medicare Advantage plans is that they have a lower premium than option 1. So Medigap plans nationwide, the price varies depending on the state that you live in, but it typically costs over $100 per month if you recently turned 65 and live in one of, I'll keep it to dozens of states because I don't know exactly where you might be watching this presentation, but it's typically a reasonable premium of, let's say, $90 to $145 per month if you recently turned 65. However, for Medicare Advantage plans, approximately 65% of Medicare Advantage plans have a $0 premium. However, you still owe your Part B premium of $185 to Uncle Sam. So I know this question came up in Fritz's community in advance of the presentation. They asked, do I still owe my Part B premium even if I'm on a Medicare Advantage plan? And the answer is yes. The government still collects the Part B premium of $185 per month, even though your Medicare Advantage plan is responsible for administering your hospital and medical benefits. Now, why is Medicare Advantage known as all-in-one coverage? Well, the reason is because it typically comes with prescriptions bundled in, and many plans also offer dental, vision, hearing, and other benefits, but those specific benefits will vary based on where you live. And so this is another reason why it's so important to evaluate all your options. You know, on the Medigap side, it's so important to evaluate because the carrier's prices differ even though they're offering the same exact product and you're making a lifetime purchasing decision. On the Medicare Advantage side, it's important to evaluate all your options because there's hundreds of insurance companies offering thousands of different plans in many places that in many zip codes. In fact, there's over 50 plans on offer. The plans vary based on the doctors that you see. Their provider networks vary. The plans differ based on the drugs that you take and how they cover them, or the pharmacies that are in and out of network. And the plans also vary based on the bottom line, what their out-of-pocket maximum is, what their copays are when you go to the doctor, and what a hospital stay might cost. And this is critical. It's critical to evaluate and consider all your options so that you can find the single best fitting plan for your needs. And of course, this is something that our team is here to help you with. We've built a proprietary database to help you evaluate all of your options based on your doctors, drugs, and priorities. And then you'll have a one-on-one conversation to find the exact match for your needs. Let me turn to the fifth mistake we see people make, which is that they don't choose drug coverage. They don't choose drug coverage because they might not take any prescriptions. They assume that choosing drug coverage isn't important either because they're not taking prescriptions or perhaps they're on generics. It is so important to consider Medicare Part D when starting Medicare, because you know that there's a lifetime late enrollment penalty if you fail to sign up timely. And you also know that what if your health changes? What if you need prescriptions that are added over the course of the year? The other reason it's important to not forget about the third leg of the stool, Medicare Part D, is because of the improvements that went into effect as of January. Here are the improvements that happened as of January 1st. The most significant one is that for the very first time, there's going to be a maximum out-of-pocket cap on your Part D costs. The maximum cap is $2,000 for this year. However, the plan that you choose needs to cover all of your prescriptions. If there's a medication that you take that isn't covered under the plan that you choose, then that drug isn't subject to the $2,000 cap. And that's why it's important to work with someone independent and unbiased who has access to all plan information and can let you know whether the plan that you're considering covers the prescriptions that you take. The second improvement that went into effect is that the donut hole was eliminated. So a lot of people had questions as to what the donut hole is. And guess what? You don't need to worry about it anymore because it's out the window. Now, if you still want to know, because you're a Medicare nerd like me, I'll tell you that the donut hole was when you owed 25% coinsurance, and it applied to people who were on brand name or expensive specialty medications. But you should know that the donut hole has been eliminated for 2025. And then the third change that I want to highlight here is that previously, when people took expensive prescriptions, brand name, or specialty medications to fight cancer's metabolic pathways, let's say, they could have owed thousands of dollars upfront. When they first started Medicare Part D, they might have owed thousands of dollars in their first couple months on Part D, and they would have owed it each calendar year. Now, for the very first time, you're allowed to smooth your drug costs over the course of the year, and your Part D insurer is actually required to tell you about this smoothing benefit and offer you the opportunity to enroll in it. So if you're on a brand name medication or an expensive prescription and you previously owed several $100s up front, this might be something to opt into so that way you can smooth out your costs over the course of the year. Now, let me turn to my favorite Medicare mistake I see people make, which is that they assume their neighbor's plan is a good choice for them. This is my favorite mistake because, look, your neighbor is a wealth of information for so many things. Mine fixed my electricity yesterday. However, your neighbor probably doesn't see the same doctors as you. They don't take the same prescriptions as you. And they may have different priorities than you do. They probably have grandchildren that live in a different neighborhood than you do. So instead of going to your neighbor to find out which plan to choose, remember, they're just one data point. Instead, we need to use your 3 Ps. And I write about this, and it's not that complicated. And it's how I train our team here at Chapter. The 3 Ps are your providers, who are the doctors that you see. What institutions would you want to go to if you developed a critical condition? The second P is your prescriptions. What medications do you take, brand name or generic? What pharmacy do you like to go to, a national chain or the mom and pop drugstore down the block? And then the third P is your priorities. What's important to you? Are you a homebody? Do you have an RV? Do you plan to travel abroad? All of this will factor into finding whether you should go with Medigap or Medicare Advantage, and then narrowing down to the single best fitting plan for you based on your 3 Ps, not anyone else's, but yours. And it might surprise you, even you and your spouse might not have the same 3 Ps. And so this is something that we do one-on-one with you. And it's a very useful framework for you to use as you consider whether to go with Medigap or Medicare Advantage, and then sort through which specific insurance company and which plan to choose. To close things off, the 7th and final Medicare mistake we see people make is that they only review their coverage one time when they first start Medicare. You know, at this point, you can't do that. And the reason you can't do that, or shouldn't do that, let me say, is because the plans change each and every year. Now, Medigap doesn't change because it's standardized under federal law. But you know that even if you choose Medigap, it's still recommended to select a standalone prescription drug plan so that you have your drugs covered. And you should review your drug plan each and every year. And the best time to do that is in the fall. On the flip side, if you go with Medicare Advantage, the Medicare Advantage plans are changing each year because the premium and costs are changing. The benefits offered by the plan are changing. The physician networks might be changing. And then there's competition, right? You know that in a given zip code, there's likely over 50 different Medicare Advantage options. So though you may have been on the best plan for last year based on your 3 Ps, what about for the upcoming year? What if there's a new entrant to the market? That plan might be a better fit for you than the one you were on previously. And this is something an independent, unbiased advisor can really help with. Make sure that you ask your advisor how they're searching across all your options. Ask them, how often have you recommended a company, a plan that you don't earn any money from? And then finally, ask them how many plans they're actually appointed with. The answer might surprise you. Many insurance agents are captive to a specific insurance company, or at most are only appointed with 3 to 5 different insurance companies. At Chapter, our advisors, as Fritz mentioned, are blinded as to which plans pay us and which ones don't. The only thing that matters to Chapter, the only thing that matters to our advisors is making the single best fitting plan for you based on your needs. That has been true and that always will be true. And I don't think anyone else can say that. So with that, let me turn to the frequently asked questions. Fritz, is there anything that came up in the Q&A?
Yeah, let me explain how this went. Number one, we had a great response. Thank you all on the email that I sent announcing the webinar, and then in the comment section. And by the way, for those that didn't pay attention, Ari was very active in the comments. So if you asked a question in the comments of that blog post, and you haven't been back to check, Ari answered a fair amount of those questions directly on there, which I appreciated you taking the time to do that, Ari. So what we did a couple of days ago, Ari and I and Kevin, who's listening to the comments right now, so we might get his input here too as we wrap this up, but we'll go through these questions that we've selected. We went through all the questions and we kind of said, what are the common themes? what are the most common questions that Ari hears from others, and let's kind of put down the top. I don't know, I'm going to put in here maybe 6 or 7 questions that kind of captured the majority of the types of questions we were getting. And we said, let's just put them in the presentation so we can go through them. But these are all based on the reader questions, either through the blog or through the email. So thank you all for your participation on that. With that, Ari, I'll let you go ahead and address each one.
Let's do it. So the first question that we received is, does Chapter have a tool to help me evaluate all my plan options? And the answer is yes, a resounding yes. This is exactly why we started Chapter in the first place. What may surprise people is there's 24,000 different plan options nationwide, over 24,000. And it varies zip code by zip code across the United States. So in a given zip code, I'll use Cook County because that's where my mom lives. She lives in the Chicago suburbs. In my mom's zip code, there are over 50 different Medicare Advantage plans. There's over 100 different Medigap offerings. So even though Medigap is standardized under federal law, there's still a lot of competition between carriers over price. And then, of course, there's over 20 Part D options. There's over 20 standalone prescription drug options. So it was really important to us to have a tool, and we built one. And it took a lot of engineering time in order to build this tool to help someone evaluate all their options. And again, it varies zip code by zip code. And what we do with that tool is we match you to a short list of plans that meet your 3 Ps. And remember, your 3 Ps are your providers, what doctors you see, your prescriptions, what medications you take, and then your priorities, what's important to you. So we input your 3 Ps, and then our database spits out a short list of plans that check all your requirements. And then we go over those plan options with you so that you can find the single best fitting one for your needs. And then we help you submit the paperwork and provide ongoing support for any hiccups that come up along the way, or to just help you get the most out of your plan. The second question is, if I have a pre-existing condition, can I be denied for a Medigap plan? And the answer is yes, in 46 states, if you're outside your Medigap open enrollment period. Your Medigap open enrollment period is the 6 months after you start Medicare Part B. If you're outside that golden window to choose Medigap, then in 46 states, you can be denied for Medigap coverage. And again, something as simple as diabetes and hypertension can be considered a pre-existing condition. So if that applies to someone listening, think really carefully about making sure that you sign up for Medigap during your Medigap open enrollment right, if you're interested in Medigap. Now, what are the 4 states that are the exception? They're all along the northern Atlantic seaboard, and they are New York, Connecticut, Massachusetts, and Maine. So if you live in one of those 4 states, New York, Connecticut, Massachusetts, or Maine, then you actually have a guaranteed issue right to sign up for Medigap, and you don't need to worry about your Medigap open enrollment right, though it is still probably a good idea to sign up when you first start Medicare Part B if you know you want Medigap in one of those states. If you don't live in one of those states, then you need to be cognizant of signing up for Medigap when you're in your Medigap open enrollment period, which, to beat a dead horse, is the 6 months after you start Medicare Part B. The third question I wanted to go over, this was a pretty common one in the Q&A, is someone's past age 65. They plan to continue working for at least another 2 to 3 years. Do they need to enroll in Medicare Part B? And the answer is no, as long as they or their spouse's work-provided coverage has 20 or more employees, 20 or more. So that is the critical number.
I think the other piece on that, Ari, is as Part D, the prescription plan. The one that they're offered through the employer has to meet a certain criteria, as good as Medicare.
Yes, it must be at least as good as what they would receive from Medicare Part D. And every fall, your HR coordinator, your benefit department, is required to tell you whether your drug coverage is creditable for the purpose of delaying Medicare Part D.
Yeah. So it's possible.
By and large, most employer-provided plans are at least as good as what you would receive from Medicare Part D. They're considered creditable for the purpose of delaying signing up for Part D.
And does the 20 employer and 20 employee rule apply to Part D as well as Part B? Could it be possible that you'd have to sign up for Part B, but you could still use D from a small employer?
Yes, that is possible. And so remember, if someone wants to remain on their small group work provided insurance, which means that the employer has 19 or fewer, that's what constitutes small in Medicare land, then they can use that small group insurance as secondary, but their Medicare is primary. And so that small group insurance can also cover your drugs if you choose to remain on it. With that said, it typically is very expensive to many small group employers charge you an arm and a leg for your insurance. And so you'd want to price out an apples to apples comparison between remaining on your work provided coverage and what you would get if you were to just make the full transition over to Medicare.
And last part on this one, again, we're not doing a sales pitch, people, but it's important because this is what I'm trying to offer the best solution to my readers. Does your software algorithm look at, here's an employer option, here's a Medigap option, and that will include that in the matrix when it's coming up with the best solution?
So we look at the work provided coverage separate from
Okay.
the Medicare consideration. So the first question is whether someone should start Medicare. If they're going to remain on their work provided coverage, then what we'd want to know is how much do you pay for that coverage? What's deducted from your paycheck biweekly? Is there anyone else who the insurance covers? Does it cover a spouse or a dependent? What do they pay for the coverage? Do they have the option of starting Medicare? Because it might make sense for both of you to go to Medicare. And then the third thing is, how strong is that coverage? Do you love your work provided coverage, or does it have a super high deductible and not cover very much until something is really wrong with you?
Okay, that's helpful. Thank you.
Yeah. And with that, let me bring up something about health savings accounts. So health savings accounts are amazing. A health savings account is a retirement savings vehicle for someone who is on a high deductible health insurance plan. So here at Chapter, I'm on a high deductible health insurance plan. My deductible is $6,000 for my wife and I. So very high deductible. It means we don't see $1 of benefit until we meet that $6,000 deductible. However, the health savings account allows us to contribute pre-tax to a retirement savings vehicle. And it can be a great way to save for your medical expenses as part of retirement, but it is not compatible with starting any part of Medicare. So if you are on a high deductible health insurance plan and you have a health savings account, do not start any part of Medicare. Do not take Medicare Part A, because then you will not be able to continue making contributions to your health savings account. Instead, 6 months before the month in which you intend to apply to enroll in Medicare, you should discontinue contributions towards your HSA. Now, you might be wondering, can I still use my HSA to pay for my Medicare expenses once I begin Medicare? And the answer is yes. You can use it for any qualified medical expense except paying your Medigap premium. So the only thing that you can't use your HSA funds for is paying your Medigap premiums. You can still use it to pay your Part B premium. You can still use it to pay for drug copays. You can even use it to pay your Medicare high earner taxes. So you can use it for any qualified medical expense except paying your Medigap premiums. And I love HSAs. They are a great retirement savings vehicle, but do not start Part A if you intend to continue contributing to one. All right. With that, let me bring us to a little more on the Medicare high earner taxes. How can I appeal the Medicare high earner taxes? And to do this, you use Form 44. Form 44 is the way that you appeal your Medicare high earner taxes. We will help you do this here at Chapter. The first thing that we do is we give you the most recent up-to-date version of Form 44, because this is one of the key ways in which the government can reject your application, your appeal. This is an outdated form of Form 44. It has been updated since 2022. And you want to use the most recent copy, you can Google it right now and see that there's a more recent copy of Form 44 to use when filing your IRMA appeal. The second thing that you do is you list your life-changing event. What life-changing event applies to you? And again, the two most common are work stoppage or work reduction. And the third most common is divorce. Then you list the income that you want the government to look at, the more recent year that you want the government to look at. Remember, IRMA is a 2-year look back. So for 2025, the government's looking at your 2023 or 2023 tax return. So if you want the government to look at 2024 or 2025, you list that year under step 2. And then finally, you sign the form under penalty of perjury. There's no additional documentation needed. If Social Security does need additional documentation, they reach out to you, and then you submit it by certified mail to your local Social Security office, or you can fax it. All right. One more common question that was coming up in the community is how difficult is it to move between plans and providers? I love this question. So if you're on a Medicare Advantage plan, then the time to choose your coverage is each fall. Now, if there's something suboptimal about your plan, then there is an additional window that you can use to adjust your Medicare Advantage coverage. It's actually going on right now, and it ends March 31st, and it's called the Medicare Advantage Open Enrollment Period. And you can use this to adjust your Medicare Advantage coverage, or you can use it to switch back to original Medicare and choose a standalone prescription drug plan. So if you're watching this presentation and you said, oh, I'm on a Medicare Advantage plan, I did not realize that I actually wanted to be on a Medigap plan, then now is the time that you can use to see if you might qualify for a Medigap plan and switch off your Medicare Advantage plan. Once this period ends at the end of the month, then you would need a special election period in order to change your coverage. A special election period if you want to do it before the fall. And something like a move would count as a special election period. Something like coming off work-provided coverage would count as a special election period, or losing the option of alternate coverage would count as one. A natural disaster being declared in your community would count as a special election period. But it is not a special election period if your provider drops out of your Medicare Advantage network. That would not create a mid-year switching opportunity. So you should know that with Medicare Advantage, the network can change even mid-year. And that's something to consider, because if your doctor leaves the plan mid-year, it doesn't create an opportunity for you to adjust your coverage. You'd have to wait until the fall if you miss your Medicare Advantage open enrollment period, which again ends March 31st. The other thing I just want to mention here at a high level is, remember, for Medigap versus Medicare Advantage, if you have a pre-existing or a chronic condition, then in 46 states, you're time restricted as to when you can sign up for Medigap without having to answer any questions about your health history. So again, if you just turned 65 or you just started Medicare Part B and you know you want Medigap, the best time to get it is when you're within 6 months of having started Part B. Fritz, any questions in the Q&A that I can address?
I think we got to go to Kevin for that.
There's a lot of questions. Yeah.
I wish we could see the comments. I haven't been paying any attention.
I've been responding to ones as I can, but you're better suited to address some. I've seen a bunch of questions about our business model and whether or not we actually charge the seniors, or like how exactly this all works, and then how we're actually different from like a Boomer's Benefits or someone else like that.
There's no charge to work with Chapter, and there's no strings attached. It's actually illegal for Medicare advisors to charge you for their services. Now, as to how we're different from anyone else, the whole reason we started Chapter is to help you evaluate all your options. So the way that we do this is so important. We have built a technology platform that has all Medicare plan information and allows you to find the single best fitting plan based on your 3 Ps, based on your providers, your prescriptions, and your priorities. And then it ranks all options available to you, and you discuss a short list one-on-one with one of the senior Medicare advisors on our team. which I train.
Well, let me touch on that, Ari, too, because I'm talking to Rodney, my friend, who just went through this yesterday. The link that you see there, askchapter.org/retirement, that'll take you into this thing, and I'd appreciate if you'd use that one, because as I mentioned in my blog post, I've got an affiliate relationship with these guys, so that's how that they know that you came from me. And they actually, when Rodney called, they said, "Oh, you came from Fritz at the Retirement Manifesto. Thanks for coming in, whatever." So it's kind of cool. But the process, he said it was very, very quick to fill out a couple questions on the screens, the flow. And then he got a call back from one of your agents, Matthew, and he said, it was within a couple hours. And Matthew we went through a couple things, and he said, "Okay, here's your best choices. Here's your top three. Here's the advantages of 1 versus 2 versus 3." And he said, it was amazing. Within 30 minutes, he had all of his Medicare questions answered. I was blown away. So it is literally that easy when you're using the software that you've got. So it's not anything that any of the people watching this have to do on your own. That's what Ari and his company do. They walk you through it, and every year they're still there. They'll review it with you again, and they'll ask any questions mid-year if you have any questions. So it's, I'm just trying to find something that I think fits a need. I think there's a real need in the marketplace. I can't say specifically what the difference is between you versus, say, Boomer Benefits is another big name, but I think this proprietary software that you have is unique from my research. It sounds like that's a pretty neat technology that you have.
And Fritz, let me also mention Medicare.gov here, because Medicare.gov also has plan information. If you try to shop your Medigap plan options through Medicare.gov, it will just give you a range. So there you won't be able to investigate which insurance company is offering that specific lowest price. What you also won't see is the credit worthiness of that insurance company. And you also won't see our 20-year sum of premium index, because that's proprietary. The 20-year sum of premium index takes your current age, and then it looks at what a carrier would charge you based on today's prices at 5 years down the road, 10 years down the road, 15 years, and 20 years. And then it sums those premiums together to create a basis for comparing one carrier to another. Because remember, the plan letter types are standardized, right? For Medigap Plan Letter G, the hospital and medical benefits that are offered by a given insurance company do not vary, but the prices can vary tremendously. And there can be tens of thousands of dollars in savings because you're making a 30 to 35 year purchasing decision, because that's how long actuarial tables suggest. That's how long the Social Security Administration's own actuarial tables suggest you'll live if you're turning 65 today.
The other thing I would say, go ahead, Ari.
Oh yeah. So that's on Medigap, but I just want to, we have a real, your audience is so knowledgeable. So I want to just give them the breakdown of how it would go for those two types that I mentioned. That's for Medigap. Now for Medicare Advantage, if you try to go to Medicare.gov and search Medicare Advantage plans in a given zip code, try entering your doctors. You won't be able to see whether a doctor accepts that particular Medicare Advantage insurance plan. You also won't be able to see other additional benefits that might be important to you within that Advantage plan, because that can be where the rubber meets the road if you need dentistry, for example. It won't tell you exactly how much dental benefit you get unless you click into the evidence of coverage. The answers to those questions are what our advisors have at the touch of their fingertips, thanks to our proprietary database.
So I hope you can all see why I was impressed with Ari and the company. I'm sure some of you still have questions. We could maybe, I think we're probably at times, we'll probably call it at this point. But if your question didn't get answered, or if you just want to talk to these guys, call that number up there, 775-565-0284. Somebody will answer the phone. You're not going to go to India and get some, customer service person that doesn't speak English. They've got good customer service people that you can just ask them the question, no obligations. You could shoot me an email, but I'm just going to send it on to these guys because I'm not going to know the answer. So, write that number down and give them a call tomorrow and say, hey, I just saw that webinar. They didn't answer my question about veteran coverage. What should I do with this or that? There's so many individual questions that were in the questions that they were too individual focused and we couldn't address them. So I know there's people listening that weren't able to get their questions answered. And the best way to get those answered is just call that number or go to that website and just talk to these guys. No obligation, and just get your question answered. You can still go any other route you want to decide on your insurance, but you can get your questions answered. That's part of why we did this webinar.
And there's one more question to flag. I think it's particularly timely. One person is mentioning that they have Medicare Advantage. Do they have to wait until the fall to do a switch?
No. Right now is the Medicare Advantage open enrollment period. So this is a second crack at making sure that you're on the right plan for the rest of the year. And you can actually use this time period in order to switch to Medigap and a standalone prescription drug plan.
Up until March 31st, correct?
Exactly. So you would go back to original Medicare, and that would allow you to apply for the Medigap plan. And if you live in New York, Connecticut, Maine, or Massachusetts, then you're good, guaranteed issue. However, if you live in one of the other 46 states and you're 6 months past having started Medicare Part B, then we would look for a guaranteed issue, right? Those those are few and far between. And if not, you would just go through the carrier's health questions, the carrier of your choosing. It's not like a life insurance exam. No one comes and takes your vitals, your height and weight, and your labs. Instead, it's just a few questions about your recent health history. Like, have you been hospitalized in the last 24 months?
Anything else, Kevin?
There's a bottomless list. I think we got to cut it.
Well, that's great. That means people are engaged, and there's a real need. I think my biggest takeaway from this, and I'm so glad, Ari, that you and I connected and we decided to partner on this. The reaction to the blog post I wrote, the reaction to this webinar, it just screams to me that we're all facing the same challenge of how do you figure this stuff out? And my message is, hey, I'd rather put my time into finding somebody that can help us than try to figure this all out and just help me, myself, and I. So I think this avenue hopefully offers all of you that are listening at least a place to go and ask a question and see what you think for yourself. And you know, a lot of us are DIY investors. That's great. I'm a DIY guy. I always have been. I'm not going to DIY. I'm not going to DIY Medicare. It's just too complicated. You got the experts out there. It doesn't cost you anything. That's why I partnered up with them. Hopefully, you know, and guys, shoot me an email. You know, first at theretirementmanifesto.com. Shoot me an email if you run into a problem with these guys. Let me know, and I'll call Ari and I'll say, hey, Ari, you got a problem over there with Bob. You know, we'll address it because we've got that kind of relationship, and I'd be happy to do that because I'm the one recommending them. So. I believe them, and what I said, and I'll say it again, it's an affiliate relationship, which means I get a small commission if you guys sign up. I don't care about that. What I said in my blog post, and I'll stand by it here, is I'm giving away 50% of whatever I earn from these guys to charities. I'm not doing it for the money. I'm doing it because I think it's a service that's needed in our community. And I think these guys are the best ones that I've been able to find that offer it. So that's it. That's why I'm doing it. My motives are pure. And I hope it's been helpful to everybody. And Ari, Kevin, everybody on your team, we really appreciate you developing Chapter and your software. And I hope it helps all of my readers to solve this frustratingly difficult problem.